All right. Good afternoon, everyone. A very happy Saturday. And thank you for joining the session. This is our session number 5 in our healthcare improvement series. And many of you been part of since session 1. And every week we take some important topics, that can help us improve healthcare. So in today's topic, we'll be talking about one of the important tool that has helped me a lot in my professional career whenever we talk about process improvement, project improvement, doing data analysis. This is a game changer. I'm sure many of you heard about it, and of course, some of you might have used it as well. So let's keep the session very interactive. And I would like to ask each one of you how many of you have used Pareto analysis before? You can unmute, you can raise your hand, whatever the way you want to respond. Your call. How many of you have used Pareto analysis or know about Pareto analysis? Ved, Dr. Muhammad, Basma, Khadija, or you can write in, okay, Dr. Muhammad Yunus has used, confirmed, or you can use chat as well to write down. That's also okay. Okay, so Basma is saying no, and Khadija has used 2 times. Perfect. Okay. All right. So that's very interesting, and I'm very much confident that after going through today's session and the live exercise we'll use, you will first of all understand how powerful and impactful Pareto analysis is. First thing. Second thing is I'm very much confident going forward you will start using it more often than before. Maybe there's something that is not understood properly that has sort of prevented you from using it very often, but this is a very, very powerful tool. And in some of the cases in the past, my whole analysis was actually done only using Pareto analysis. So what is a Pareto analysis? Let's understand a bit about it. And we have one more, Dr. Weil also joined, and there's one more candidate who has joined now. Let me admit. All right. So when we say what is Pareto analysis, first of all, let's understand it in a simple term because this is how it looks to people. This is what they think about it. It's a bar chart which is arranged in a descending order of height from left to right. Bars on left relatively more important than the those on the right, and it separates the vital few from the trivial many. This is the most important part. That is why we are calling it Pareto analysis. Of course, it is represented when we call it Pareto chart, but principally it is called Pareto principle. When we do analysis using this principle, it is called Pareto analysis. When we make it visual, then it becomes a Pareto chart. So this is how the chart looks like. Now you might be able to relate to it. Might have seen this kind of chart with the height of the bars decreasing from left to right and a cumulative percentage line. But we'll understand all of it in a detailed way today. This session is more about doing a hands-on exercise. I have created data of 20,000 rows, patient complaints data that will dissect using the Pareto analysis. So Pareto chart helps us to highlight the vital few in contrast to the trivial many. So what happens whenever in a working environment, we are dealing with the data, we are dealing with the problem, we are dealing with so many variables, and it is not possible for us as a process improvement champions or agents to attack each and every variable. So it is very important for us that with the available resources and time and effort we have, we are able to make the maximum impact. In order to make the maximum impact, we need to identify those variables. Those are contributing the maximum to the problem or maximum to the effect. Basically, we have many causes and there is an effect. For example, patient is waiting in a hospital. So the causes could be 20 such causes. So we cannot work on each and every cause. So we need to understand what are the vital causes that we need to focus on. Same way with any problem, we have some medical errors coming in, we have some insurance rejection, and we need to understand what are the causes that is causing the insurance rejection. And the causes are many, so we need to identify the vital few. This is what Pareto analysis helps us do. It helps us separate the trivial many. The trivial means having minimal effect, but those are many. But then we have vital few variables which are having the maximum effect. So it is based on 80-20 principle. 80% of the problem result from 20% of the causes. This is very, very straightforward. Let's move on to Pareto history before we then eventually deep dive into the exercise of Pareto analysis. And it's a small audience. Usually in our session, I mean, to make it more engaging, more interactive, you are allowed to open your mic and add or ask or add anything that I might have missed, or there's anything that you have any confusion. So feel free to unmute your mic and speak up. So let's understand the history from where this Pareto analysis is coming. So this Pareto analysis gets its name from Italian-born economist Vilfredo Pareto, you know, who lived from 1848 until 1923. And this guy observed that a relative few people held the majority of the wealth. And you can, as you can figure out, relate to it. This is what is the case today as well. There are few wealthy people uh, who 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 held majority of the wealth versus so many other people who are like having moderate wealth or people who are with low income. So he developed a logarithmic mathematical models to describe this non-uniform distribution of wealth. And the mathematicians, Amo Lawrence, developed some graphs to illustrate it. But it started with Vilfredo Pareto, who said that relatively few people held the majority of the wealth. Now, Dr. Joseph Juran, he is one of the quality group. He was the first to point out that what Pareto and others had observed was a universal principle. It's not just about wealth. It is applicable to any other situation, one that applied in variety of situations and appear to hold without exceptions in problems of quality. So he said that the Joseph Juran observed that it's not just about wealth, it is about any case, majority of the problems, let's say, coming from 20% of the sources. Majority of defects are coming from 20% of the sources. Majority of the good work is coming from 20% of the people. So he said that this is applicable to any environment, and it is also applicable in when we are dealing with problems related to quality. So in early 1950s, Joran noted the universal phenomena that he has called Pareto principle, that in any group of factors contributing to a common effect, a relative few account for the bulk of the effect. And Joran has also coined the term vital few and useful many to refer to those few contributions which account for a smaller proportion of the effect. I hope this is making a story now. So, but this is not something, I mean, of course, you might have not used Pareto analysis in Excel or doing analysis, but this is, we all observe, right? We intuitively recognize that Pareto principle and the concept of vital few in operations in everyday business situations. For example, you might have observed that the top 15% of our customers account for 68% of total revenue. This is kind of discussion sometimes happens in a management meeting. The top 20% of our customers account for 80% of total revenue. Or our top 5 products account for 75% of total sales. So this kind of analysis is being used to demonstrate the Pareto principle, Pareto analysis, even without knowing that it is a Pareto analysis or Pareto principle, which has been identified long before. Same way, we can always say that, there's always few employees who account for the majority of the absences. Or let's say, in a typical meeting, a few people tend to make the majority of comments while most people are relatively quiet. This is very common. This is what this effect is demonstrating, the concept of vital few and trivial many, and it is applicable in all the environment. So I hope this make things very clear. Now, how do we use this analysis in in helping us improve our processes or solving a problem or diving deep into the root cause analysis of any issue? In order to do that, we'll do a quick exercise today. And in this case, we'll go step by step. And I will also teach you how to prepare these charts in an Excel in a very easy way. You don't need to use any software tool, any other kind of program to do this analysis. It's very straightforward. What is more important is your structured thinking method. How do you want to approach the data set, and how do you want to dissect your whole data set into different segments so that you can make some meaningful observations out of it. So for this case, today's session, what I have done is that I have prepared a data set. I hope you can see this. Can you see my another Excel now, which is having a data set? Can you confirm? Perfect. All right. So this is a patient complaint data set, and let's quickly walk through some of the variables. First of all, let's see how big the data set is. It is 20,000 complaints data set. All right. And we have variables month, department, category of complaint, subcategory of complaint, complaint severity, patient type, day of week, what day of the week the complaint is coming, time of day, resolution status, and patient age group. So let's go very slowly, and I want all of you to understand and observe. So now we need to make, now there's so many complaints. Let's see how many types of complaints are there. Probably 1, 2, 3, 4, 5. We have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 types of complaint, category of complaints, and maybe around, I'll not count it, but looks like around 30 subcategory of complaints. And let's talk about department. We have around 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 15 total departments. And we have patient type, ER, inpatient, outpatient. Now, if somebody, a management gives you an assignment that we need the patient complaints are increasing on month basis, and we need to drill down and need to reduce the patient complaint. So you as a project agent or process improvement expert, how are you going to approach this problem? So let's go step by step. First of all, we need to understand, is there a trend across months? So I'll use a pivot analysis to understand the trend, and then we'll slowly dive into the Pareto principle. So let's understand whether there's a trend across months or not. That is the first thing we need to understand. So I hope, I just want you to raise your hand who among you have used pivot analysis in Excel. Who's familiar? Dr. Weil is familiar. Okay, perfect. So we have two people who are familiar. Dr. Mohammed. So we have three people who are familiar. All right, fair enough. So let's start with understanding the trend. we want to see whether there is a trend since each row has some data. So I'll take count of anything. Okay. So here we go. So we have around, okay, so this is our complaint on month basis. I don't see a trend of increasing, but at the same time I don't see a trend of decreasing complaints as well. So this does not give us anything that we can segregate that June, July, August has the maximum number of complaints, or certain months has the maximum number of complaints. So let's not, the month is not giving us a trend, so that means we cannot drill down further at a month level. It could be that at a department level we can go, and then we see that certain department has a month. Let's see, let's do this. Let's add department in columns as well and see a trend. Okay, so if I see admissions, cardiology, dermatology, emergency, general surgery, no. So okay, let's see how it looks like. I don't see a trend as such, but then we can use some conditional formatting. Let's see. Okay. Not a major shift in trend, other than that December has gone up in admissions. Cardiology remains almost same. Internal medicine, the maximum it goes around 10%. So except this month, psychiatry was a big complaint, number of complaints in the month of May. But I don't see like top 2 and 3 categories contributing to say 80% of the problem. So that's not something which is giving us a trend. Let's look at another pivot, and I'll drill down into a department level now. Let's say department, and the values are the count of complaints. Let me sort this largest to smallest. All right, here we go. So now here clearly we can see a trend that some of the departments are contributing more to the complaint versus others. Now, this is a very good example of using Pareto analysis. So let me do one thing. Let's say now you are doing analysis and you figured out, okay, there's a trend. I don't need to focus on all the departments. I can see that the majority of complaints are coming from few departments. So let's create a first Pareto analysis. I'll copy the data here, values and source formatting. So what you need to do in Excel is that when you have a data like this, okay, so you just put them in two columns. One is your row, whatever it is. I'll just put the table first. Okay, let's call it department. And this is the count of department. This is not a count of department in this case. This is the number of complaints. Okay. Now the first thing you do is you add a column which is percent of total. What percent of this complaint is from the total data points? So basically we need to divide this divided by the total, which is 20,000 in our case, and I need to freeze 20,000 because this is where it stands. And this will give me, when you convert your data set in a table, you don't need to copy the formula down to the bottom. It automatically copies the formula. That is the reason I freeze the 20,000 box, because otherwise what would happen when the formula will drag down, the second row will take data point, third row will take this. So we need to freeze this data point by adding the dollar sign on around it. Let me convert this into a percentage. All right. Now, the second step of creating a Pareto chart and Pareto do analysis is to calculate the cumulative percentage. Cumulative percentage is that every item keeps on adding up with the previous item, and and then showing up how much cumulatively that the 2 and 3 and combined items contribute versus the total number of defects. So we'll start with the same data point because it starts with 23, but now we are not supposed to copy this. So what I will do is I will add this previous data point with next data point. And this I need to convert because this is taking up the formula. So what I will do is, in this case, I will convert this into range. Fair enough. I'll copy this, and then it is now cumulative sum. So this second row, basically we are starting with 23% because the first item is contributing 23%. Second item is contributing 18%. So cumulative, we have 18 plus 23, which is 41. Now the third item is contributing 14%. So in cumulative, we have 41% plus 14, 56, and so on. So it's a cumulative sum. Now we need to make it, show it in a visual way. This is what Pareto chart is called. So what we will do is that I'll select this column, then I'll select number of complaints column, and I'll select cumulative percentage column. I'll not select percent of total column. I'll select 3 columns. I'll go to insert. I'll check. I'll take one. Okay, let's start with, I'll select column chart. And this is how it will look like, column chart. Let's expand it a little bit. Okay. Now what I need to do is, because I need to show the first data point, first column, which is the number of complaints in a bar, but I need to show the another line which shows the cumulative percentage, like we have seen here. In the previous Excel that we started with. So what I will do is I will go to this chart design. I'll change charge type. I'll make it a combo. Then I'll select this line. Now it has turned into a chart with columns and line. I'll format data series. Because these are not the same scale, the bar is in numbers, absolute numbers, and the line is in percentage. So I'll select the secondary axis. And now this line is following the percentage axis and the bar is following the absolute number. So we are almost there. So Pareto by department. I usually in my analysis, I don't like grid lines. So I remove the grid lines. Let's change it a bit, add a marker. Now this is just a visual things I'm doing the way I want the chart to look like, but that's up to you. You want to just keep it as is. The job is done. Job is done. We just need to make it a little bit more visual. Solid fill. Okay. I'll make it solid line, black, marker, solid line, black. Here we go. And what I will do is I'll add the data labels now. These are my number of complaints. And this is I'll add data labels. Now data labels are not visible here. So what I will do is, and I'll fill this data label with some yellow color. Perfect. So now it makes it very, very visual. Pareto by department. And now let's analyze this. Okay. So now when you were presented with this problem, you were given that we have 20,000 patient complaints across 15 departments. We have so many categories and you cannot boil the ocean. So you need to make some meaningful information out of it. So what we have done right now is that we have done a Pareto analysis by department and we can clearly see that. And I want you to tell me what are the departments that contribute 80% of the complaints? Please speak up. I want you to observe this chart and tell me what are the departments that contribute 80% of the problems.
Start from general surgery to laboratory.
Which one is the top?
Starting from general
Can you
surgery
speak
to
again?
laboratory
Sorry.
in that range. It is from general surgery to laboratory at that range, you mean?
No. So okay. So okay. Let's do one.
I think the ER and the cardiology.
Yes. So we have ER on top, cardiology. So ER contributes 23%. ER plus cardiology 41%. ER cardiology pediatric 56%. With ortho 65%, with radiology included 75%, with oncology 79%. Let's stop here. So this is a first step of narrowing down the problem. So you don't need to work on all these other departments. You need to focus only on this department. Let's call this. Let's do one thing. Let's call them. And I'll be sharing this Excel with all of you after the session so that you can redo the exercise to understand it more or do another analysis. Vital few. And this is our trivial many. This is vital few and trivial many. Now tell me, is this step clear to you? Is this step clear to you? All right. And what is the takeaway from this step? Can somebody repeat what is the takeaway from this analysis?
We take until 79%. The emergency and cardiology, pediatrics, orthopedics, radiology, oncology, and general surgery. We stop here.
Perfect. But in general, what is the takeaway? For example, you are now speaking with the
majority
management.
Of issue,
Yeah.
the majority of issue come from the minority of the people as they make the majority of complaints, just narrowing this 20%.
Perfect. So if a management asks for, Alam, we have given you a problem. So what is your approach? Probably the first takeaway, I'll say that, that 20,000 complaints coming from 15 departments, but 80% of the complaints are just coming from 6 department. So I will say that I will not focus on other department at the moment. I will focus only on 6 department. So that will be my first takeaway. All right, fair enough. So let's move to another level down now. I'll call this Pareto 1. And I'll call this Pareto 2. We'll do Pareto 2 now. Okay, so now which is very clear. So let's understand now at the same time, you cannot work on all 6 departments together, right? Let's start with emergency department. And I want to understand what is happening in emergency department. Okay. So in emergency department, this session is being recorded as well. So I'll go a little bit fast, but you can always go back and check the recording later on and redo this analysis. So what I will do is I believe some of you who have not used Pareto very often, you might find it a little bit hard following the steps that I'm using right now. So I'm using now department as a filter, and I'll put category of complaint in rows. So I don't, since I've decided that I'll first look what is happening in emergency department, I'll apply a filter of emergency department. Here we go. So this is my second Pareto. I'll copy this. Now this gives me a distribution of 4,598 complaints in emergency department. And it gives me a distribution of what kind of category of complaint is this. This gives me a second Pareto. I'll copy this information. I'll use the same template. I'll just paste this information so that I don't need to do it again. Control C. I'll paste special values. Okay. This is not 20,000. This is some of these complaints, which is 4,598. Everything, because this is chart which is already made, everything adjusts itself on its own. So now you know, okay, I'll go a step back. So first what we did, we looked at from where this 20,000 complaints are coming from. And the objective, the first Pareto analysis told us 20,000 complaints, majority of them are coming from emergency, cardiology, pediatric, ortho, radiology, and oncology. Now, the second step is that since all departments are totally different departments, we cannot combine them together. So we need to understand what is happening in each department, because the nature of problem in each department could be different. Okay. So what we did, we now looked at emergency department, and we want to understand what is the trend in emergency department. Now the data set of emergency department is now 4,598 complaints. So our second Pareto is based on emergency department, which is and type category of complaint. COMPLAI. Okay. And I'll just write it down as Pareto ED. Now you can see the chart has updated itself. Pareto complaints, I'll say ED Pareto complaints category, because this is a category. Okay. So now tell me, what are my categories that is contributing to 80% of the issues in emergency department? This is our another takeaway.
The first four.
First four, right? So I don't need to boil the ocean, and I don't need to focus on all the 15 categories. I need to focus on these categories. And these categories are staff conduct, wait times, billing issues, quality care. All right. And this becomes my vital few, and this becomes my trivial many. So let's do one thing. I'll create one table synthesis synthe. Okay. Can you take a picture of this, because I'll be asking you certain questions so that I can fill up this table. Take a picture of this. I hope you did it. Take a picture of this as well, this chart as well now. All right. So let's create a table, top department to focus. What is my top? What are my top departments to focus? Can you name it in the same order?
Emergency, cardiology,
Okay, one is ED, second is
cardiology,
cardiology, third is
pediatrics,
peds,
ortho,
ortho,
radio,
radiology,
and oncology.
oncology. Perfect. Now, top complaint category to focus. So we looked at top complaint category in emergency. What were the top complaint category? I'll just copy it so that I don't need to write it. Just hold on. I think this one, two, three, four. So I'll just copy four. One, two, three, four. One, two, three, four. Perfect. Control C and ED. Now we have top complaint category to focus. So now we're drilling down, correct? Perfect. Now, does this story ends with category of complaint? What is the next level of Pareto I should do? What do you think? Now I know that I need to focus on these four and I'll be able to solve my 80% of the issues. I don't need to go and talk about these trivial many. But now
You have
we have, yes, please.
to apply for other departments in order to know where is the majority of the top four.
Correct. So that we will do. But let's say, can we say the ED is done? ED is complete? Can we now just focus on these four and figure out what is happening? So we need to do one more Pareto for ED because now we need to drill down into the subcategory of complaint. Okay. What we have done right now is category of complaint. So I'll again go back to my initial analysis. What I will do is now I will move my category above and I'll bring my subcategory below. I'll just move charts. Okay. So as you can see, you have these are the categories and we are very clear with ED that I need to work on top four, but then you have so many subcategories also. So you cannot still figure out from where the problem is coming. So what are the top four categories? Staff conduct. I'll select only those complaints. One is staff conduct. Second is wait time. Third is billing issues. Fourth is quality of care. And five is, I'll just select five as well. Five is communication. Even though it is, we in the previous chart, we did not select. Now, in these five categories, I'll just write here as well, one more category, which is communication. Okay. So in this category now, in these five categories, we have these subcategories. So as I said, we started with so many departments. We drilled down to few departments. Now we have taken up one department. Within one department, we have taken up category of complaints. From 15 complaints to we have drilled down to 5 complaints. Now in 5 complaints, category of complaints, we have 27 subcategories. You can still not work on 27 categories. So we still need to drill down further and do a Pareto analysis. So now we'll do second Pareto analysis, which is on subcategory. Now this subcategories, I'll just paste it here. Paste values. Okay. That means I need to create sum of all these here. And this I need to change this divided by total. total I need to freeze, and I need to just drag it down. Okay. I'll increase the decimal points because the bottom one is not 0, it is something. Now I'll add the cumulative line. Cumulative line is this plus this, and I'll drag it down until last. Okay. I'll just move my vital few and this here. I need to adjust my source of data. Source of data is, okay, sorry, I need to this one until 30. So 30, 40, this is okay. Y values, okay. Horizontal axis, okay. Okay, perfect. So now I have all my subcategories Pareto analysis. Now this subcategory Pareto analysis is for emergency department. So tell me one thing, is this for all these subcategories of data complaints, or is it for limited category of complaints? What have we done right now?
Did it for all for the first 5.
Exactly. Yes, limited. Very, very good. Because we don't need to look into these. So what we have done is that first we have identified the vital few of category of complaints. Now with this vital few only, we have created another Pareto, which is my subcategory of complaint. And this is my complaints by subcategory for top 5 categories of complaint. Now, this gives us another story. Now, tell me what are the top 80% subcategories coming from this bucket. So, this is somewhere here. Perfect. So, this becomes my vital few.
Priority.
This becomes my trivial many. My vital few is until here. Until here. So I don't need to again look into all these trivial many. You do not want to do something about poor hygiene when actually out of 20,000, only two complaints, not 20,000, sorry, out of say 4598, two complaints in emergency department are related to poor hygiene. So you don't need to take an action around it. We'll have a training around hygiene. We'll have a training around prescription error. We'll have a training around appointment cancellation. That doesn't need to be looked at because that is not contributing to your majority of the complaints. So now we know that we have these subcategory of complaint. I'll add my synthesis. So my synthesis says that I will have these subcategories. Subcategories, which is contributing to complaints. So I can still go a level down if I have more data, right? I can look at these trend. Let's say what other variables I have. Let's try to do this. Let's try to do this. What are other variables we have? We have variables of patient type. Okay, anyway, that has been taken care of. Days of week. We can see a trend. Let's see a trend here. Days of week. I'll add it in a column. I'll see, do we have a trend in days of weeks? I'll view has percent. Okay. So let me see. Do we have a trend here or not? No. So let's look at the top categories. I don't see a trend. So there's no trend as such, except Saturdays it is low. And the reason could be that Saturday and Sunday we have limited clinics. That could be one of the reason. So we don't need to look. And at some point of time you need to decide also where to stop, because you cannot keep on doing Pareto analysis forever. But wherever you don't see a trend, don't see a significant trend, you can stop. You can also do a Pareto analysis by, let's do one Pareto analysis, one more by age group. Instead of department, let me do one more analysis by age group. Maybe it's coming from specific category of patients. Okay, let's say 0 to 18, 1935, 36 to 55. So show values. Okay. So this is 0 to 18 is having the least category of complaints, 1934, 20%, 30 35, 29%. Even if I see the Pareto analysis, I I can still focus on age, but there's no point in focusing on age, because the actions that you would take to address these issues are going to be applicable to majority of the age groups. So you need to make a wise decision. For example, you have a separate unit. Let's say in emergency department, you may have a pediatric unit or you may have an adult unit. In that case, it makes sense to separate two category of population. But if it is not the case, same emergency department is being used for all category of patients. So there's no point of segregating it further and doing further Pareto analysis. For example, now in this case, Pareto 1, there's no point in dividing cardiology patients into different age group, because department is the same. Pediatric is department is the same. So it's a call you need to make at what level of detail you want to stop, and so that it gives you some sufficient information. So I'll 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 do a quick recap where we started. So we started with 20,000 data points with different variables. And the ask was that we need to improve the complaints. We need to reduce the complaints rate coming from different department in the hospital. And we wanted to understand what is this coming from. And we did a trend analysis in month level, and we could not see any trend. So it's constant across months. So it's not that it is increasing, but it is also not decreasing. Now, then what we did was we looked at from where the complaints are coming, maximum complaint. That was our first Pareto analysis. The first Pareto did tell us that 80% of the complaints are coming from 6 departments: ED, cardiology, pediatric, ortho, radiology, oncology. So this becomes our focus, vital few departments. Then since all departments are separate, so we'll not combine those departments. So we'll take one department each and do a Pareto analysis for category and subcategory. As an example, in today's session, what we did was we picked up emergency department, and we try to understand what is happening in emergency department. So the first level Pareto for emergency department gave us a distribution that 80% of the problems, the category of complaints, are coming from 5 types of categories, which are staff conduct, wait times, billing issues, quality of care, and communication. As you can see that staff conduct, wait times, it's also very broad term, so we cannot figure out what actions we need to take. It is still a very vague description of complaint, so we need to drill down further and understand what specific actions we need to take. Then what we did was we selected only these category of complaints because these are our vital few categories. And we did another Pareto for subcategory of complaints, looking at those top 5 categories. And it gives us a trend that out of total 27 subcategories, only 7 categories are contributing around 80% of the complaints, which are rude staff, unprofessional behavior, lack of empathy, poor communication from staff, inattentive staff, not answering staff, not explaining. And this is our first synthesis. So if somebody, let's say you are proposing that, since you have a small team, you cannot work in multiple departments. So you will start with ED. This is what you have proposed to the management. You will say that we have done our analysis, we have done our Pareto analysis, and it tells that uh, 80% of the complaints in emergency department comes from these 5 categories, and 80% within these 5 categories, the subcategory of complaints are this. And then what you will do is, now whatever is you may want to do a let's say a brainstorming session to understand with multiple stakeholders what improvement actions we can take to identify the improve actions. You will have multiple improvement actions coming from these categories. Then you will have responsibility, like a project plan. You have a deadline, you have a status. You will then monitor the trend. Okay. So you will monitor trend, say for month, when you implement these actions, month 1, then you will month 2, 3, 4. Let's say 4 months you want to monitor the trend. And once you start implementing these actions, you will see whether the needle is moving or not. And this way, your Pareto analysis has helped you drill down into a vast data, and having scattered information, no trend, to somewhere actually where actually now you can say that if I focus my maximum effort in these categories, I'll be able to move the needle to the maximum extent. This is a classic example of doing Pareto analysis. And as the data is huge, and you need to make some sense out of a data, and Pareto analysis becomes a very powerful and very impactful tool of identifying where to focus maximum of your effort. Same way, once I'll share this Excel with all of you, what you can do is you can try doing this analysis for second category, which is cardiology. Then you can try for pediatric, ortho, radiology, oncology. This way you will have a very robust table, and what you will see is that some of these subcategories will duplicate in other department as well. So that means you do not need to take a separate action. Same action that you will take will help address the pain point in multiple departments. But at the same time, eventually what will happen, you will also see that when you will do this for cardiology, pediatric, ortho, you will see that these total subcategories, it will also be 20% of the total subcategories. So 20% of all subcategories will are responsible for 80% of the effects. So this is how we do a Pareto analysis, and I wanted to demonstrate how impactful it is and how easy it is to do in an Excel. And this is where I will stop. And I would like to ask you if you have any questions at this point of time. Please shoot, please ask, and we can have a good discussion around it. We still have 3 minutes, and I'll still stay here for another 5 to 6 minutes. Those who have any other questions, I'll be able to answer. Please, thank you. If there is any questions, please ask. If you do not have any questions, you may drop off and have a nice day. I'll be sharing the recording with the session and the material as well after the session, maybe today evening or tomorrow morning. Any questions from anyone? Anything you would like to understand, ask? And I just this example is just for this kind of patient complaints data, but I think you all are wise enough, I know, to infer out of it that this principle can be applied to any kind of process that you are looking into, any kind of domain that you're working. If you're not working in domain, healthcare domain, you're working in somewhere, some other domain. This is applicable to any kind of process, any kind of scenario where actually you have multiple variables of data and you need to figure out what are the top 20% variables having the maximum impact on the output. Okay, so there's one comment. I have just a thought that most of major reasons behind the rudeness of the staff is staff shortage. So I will not conclude it because maybe we have gone through multiple sessions of lean thinking and healthcare improvement. And there's one thing that I have said again and again and again, that lean thinking and improvement is about making decisions based on facts. Now, if someone somehow is able to validate and give me a data that the staff is rude because the staff shortage is there and there's some mathematical correlation, then this sort of justifies that this could be the reason. But if what I want to say is that we should not conclude based on what we think, what we assume, what our judgment is, but rather we should validate each and every reason and our assumption that why this is happening based on certain data. For example, okay, let's say I'll quickly, I mean, if all of you can just stay, because this Shiri, if I'm right, Shiri has put a very good point that he thinks that the rudeness is because of shortage of data. Let's say number of staff. If you are able to do this, number of staff, let's say, and let's say I'm talking about a reception. Let's say number of staff at reception becomes 3, 2, 5, 6, 2, 5, 6, 2, 1, 5, 6. Let's say this is my number of staff at different point of time at reception. Okay. I'll just maximize this and then we'll close this session after. When I say validated with data, this is what I mean. And let's say you have a patient complaint, patient satisfaction score. Patient, or let's say patient complaints. Okay. Let's say patient complaints. I'm just creating some data random between say 10 to 20. Okay. I'll just put it here. Control C, Control V, data, and data filter. I'll just ascending. So my assumption is that, okay, I'll just combine this. I'll make it 2, I'll make it 3, I'll make it 4, I'll make it 5, make it 6, make it 7, make it 8, make it 9, just for the sake of data. Okay, my assumption is that whenever the staff goes down, and number of staff goes down, the complaint increases. Let's say I do a correlation of these two columns. This is my assumption. And the correlation gives me score of minus 0.42. Now, some of you might be aware of correlation analysis. Can you tell us what is the interpretation of this score? Can you tell us what is the interpretation of this score? Exactly. That means what I was saying is that uh, when the when this so assumption was that let me when the basically when the staff increases, the complaint increases, but there's a negative correlation. So basically it is somewhere related to what Shri was saying, is that when I have more number of staff, the number of complaints become little bit less, which is true. But this is not very strong correlation. This is weak negative, as Ved is saying. Sri is partially right, but the correlation analysis, what we are getting is not very strong. Had it been, let's say, let me change, let me make it uh 30, then I make it
Assalamu
control
alaikum. So do you mean so
Walaikum.
at this type of example we can exclude this correlation because there is a negative correlation between the number of complaint and the number of the staff?
Yes, we should, because we are missing one or more variable. This is not a very conclusive correlation coefficient minus 0.43 that you can say that, oh, when the staff is more, the complaints are less. When the staff is less, complaints are more. It's a little bit weak, on a weaker side. But I'm just trying to show you, when the coefficient comes like this, you don't completely rely on this assumption. But I'm just changing the dial. Let's say this become 25. This becomes, say, 20, this becomes 19, this becomes 18, this becomes 15, this becomes 12, this becomes 10, this becomes 9, this becomes 8, this becomes 5. Now you see the correlation. This is a very strong correlation, which validates what Sri was saying. When the number of staff increases, the complaints goes down, and it is directly correlated, minus 0.98. Some of you know that the correlation coefficient varies from -1 to plus 1. But when you have a correlation like minus 0.43 or plus 0.43, it is still a very weak correlation. So my point was that whenever you have any assumption, any feeling that this is happening because of this, do some kind of mathematical analysis to validate your assumption. That is the point I want to take you forward, other than doing the Pareto analysis. Anything else, please ask. Or you may just leave. Have a very nice Saturday. Have a nice weekend, and inshallah, we'll see next time on Saturday in the next session. Thank you, everyone.